Philips Healthcare is very proud of our history with Georgia Regions Health System. This alliance is one of Philips' largest, and with this collaboration we are breaking ground in healthcare delivery.
We're building on our long-standing relationship with Georgia Regions by forging a new alliance that truly puts patients first.
Georgia Regions is the only institution we have found with full alignment across a leading university, a world-class medical center, a team of physicians and residents fully committed to redefining the future of healthcare.
We've been a leader for years and known both locally and nationally and internationally as the site for patient family-centered care. We serve patients and families all over the state, and we educate across the state, and we also cover probably half of South Carolina. So broad geographic area that probably services anywhere from 4 to 6 million people.
When we were looking for a collaborator to improve healthcare at Georgia Regions, we were looking for an ally that would help us lower costs, improve patient outcomes, and do it in a way that was patient and family-centered. We were looking for someone that would work side by side with us, with our patients, with our staff, to design a patient experience, a diagnostic tool. We were looking for a long-term relationship that would allow us to be able to define the future of healthcare.
Philips is the only one who has stepped forward over an extended period of time to craft that with us. We want to demonstrate that by coming together and working together in a research and development point of view and thinking about what's next around the corner, what's going to be better for our patients and families.
Patients are oftentimes very anxious before a major procedure, especially one designed to enter their brain. So anything that you can do to help relax the patient and to mitigate that experience is very helpful. We can actually sample different color schemes. Some patients prefer blue lighting that tends to calm their mood. Another example is that the privacy glass that we have installed enables us to turn the glass on and off at the flick of a switch, thereby protecting patient privacy. One of the biggest challenges that we face in healthcare related to stroke is needing to see individual blood vessels within the brain that may be diseased. One of the more significant innovations from Philips Healthcare is our ability to actually see the length of a clot within a blood vessel, and that enables us to tailor treatment more precisely.
Some wonderful new options that we have for treating patients thanks to Philips. We now have a big bore CT simulator, which you see behind me. It allows us to put patients in an optimal position for treatment. Philips has designed a bellow system that allows our patients to free breathe while we're doing the scanning. This allows us to see a full range of the tumor motion, and the physicians are able to better plan for the patient's treatments.
In the pediatric patient population, subtle changes need to be recognized. Often it's the subtle changes that decisions are made on that affect a better outcome for that patient. We can recognize them real time and respond immediately because of what we have in our Philips monitoring systems. We can integrate it into our electronic health record and have the historical flow of that physiological information as we move patient from setting to setting. In our ICUs, our perioperative areas, and even our bedded med-surg units.
Thanks to our collaboration with Philips, we're now able to use more technology. PET-CT images, diagnostic CT, MRI can all be merged with the images that we get from our CT simulator. This helps the doctors better see things that we've never been able to see before.
I want to have someone working with me who has the same ownership in the process that I do. I don't want someone who delivers a piece of equipment and leaves. I'm looking for someone who's going to be able to work with me in the long term to improve that piece of equipment, the patient experience, and ultimately be able to deliver a much better experience and a better outcome for the patient. That's the model that we've built with Philips.
The Big Bore simulator allows us to put patients in a more comfortable position, and the speed at which it operates is so much faster. It just makes things better all around for the patient.
As a radiology chair, all of the equipment that we've installed in our department, we've installed with patients at the design table.
Everything we do stands in the shoes of the patient, looks from there, and says what will take care of this patient best. both from the actual intervention, but more importantly, from the emotional response and what that elicits.
We're going to have to use the equipment differently. We're going to have to work with our staff and our physicians differently. And we're going to have our patients engaged in their own health care in a very different way.
Our industry is on an accelerating path of change. Through our combined strengths, Georgia Regents and Philips Healthcare are primed to play a pivotal role in defining and delivering these changes ahead.
We on the provider side have to change the way we work. Philips is having to change the way that they work by bringing both of us together. It's a new solution the marketplace hasn't seen.
We're going to be doing strategic planning. We're going to be doing technical innovation. We're going to be doing operational excellence in delivery every day, helping them run the hospital.
We're working on an unprecedented scale, and our work promises to have industry-wide impact, changing viewpoints and ways of delivering healthcare. This is the future of healthcare.